morning. Welcome back to the Retirement Report. I'm Hank Parrott, your host. All right, we're talking about healthcare expenses. By the way, one of the things, if you'd like to take advantage, I'm going to throw this out every now and then. I won't spend as much time, but call my office at 615-376-5325 if you would like to get this type of planning done. When we're talking about healthcare costs, if you'd like to get a handle on that, or we're talking about Social Security, choices there, not just on when to take Social Security, but if you're already taking Social Security, how to minimize taxes on your Social Security benefits. You know, this is one of those areas a lot of people are maybe not even aware of. In fact, I know I've had new clients coming in saying, I didn't think we had to pay taxes on Social Security benefits. I thought those were tax-free. Well, unfortunately, depending on the amount of income that you have other than Social Security, up to 85% of those Social Security benefits can be taxable income. And this is one of the areas I probably spend, tax efficient income in retirement is so important, and that includes minimizing taxes on Social Security. And you get into a lot of push and pull if you're trying to do Roth conversion strategies, if you're trying to employ other income strategies that may have to do with selling off some stocks, capital gains. All of these things tie together, and you have to always be thinking of, how's it going to impact my Social Security benefits in terms of taxation of those, because that can add a lot to the overall cost of the different strategies that we might want to employ. So it's important to understand those so that we can minimize the impact of that. So tax planning is probably one of the biggest things that we get into when it comes to helping my clients as far as keeping more of your money in your pocket, right? It's not just what you make, it's what you keep. If you want to keep more, making sure that you're not paying excess taxes is one way to do that. Right? We don't want to pay more than we're legally required to pay. And yet more people, you'd be amazed at how many people pay more in taxes than they're legally required to pay, simply because they don't understand the rules and don't employ the different rules that are available to them in the tax code that are there for anyone and everyone to use. And these can help save you a tremendous amount of money. So again, if you'd like to get this kind of planning, just call my office. We'll help you with that. And there's going to be more. But I'm going to get back into the healthcare costs here. So one of the things when it comes to healthcare expenses is understanding what those expenses amount to. So for instance, prescription drug, they estimate to be about 23%. This is, by the way, the source for this information is Medicare.gov. 23% out of pocket. Medicare.gov, by the way, I'm going to, that's one you want to write down. There's a lot of tremendous useful information on that website, including a way for you to shop for Medicare supplement plans and Medicare Advantage plans. And we'll talk more about what those, what the pros and cons of those are. 32% premiums for Medicare Part B and Part D, and 45% Medicare cost-sharing provisions, in other words, deductibles and copays. So nearly half of expenses are Medicare cost-sharing provisions, such as copays and deductibles, in fact. And it's important to note that the premiums for Medicare's Part B, which is your outpatient, and D, which is your prescription coverage, as well as those out-of-pocket expenses, make up over half of your health care expense. So this is one of those areas when it comes to, as I mentioned, when it comes to out-of-pocket health care costs in retirement. If we look at a 65-year-old couple, you're looking at somewhere between $250 to $350. If you're really healthy, you may be able to keep it under $200,000 out-of-pocket over your retirement years. Imagine that. That's a tremendous amount of money. Can you write the check? Do you have a plan to help make sure you're making enough money on your money to be able to help cover these expenses in retirement? Medicare covers only about 62% of expenses associated with health care services. So Americans on the whole, and this is going, again, according to the study, Americans on the whole are not prepared for the reality, rather, of healthcare costs in retirement. In addition, Americans don't really understand how Medicare works. So according to the study, for example, 47% of people surveyed think that Medicare helps pay for long-term care, and it does not. This is an important fact to understand. If almost half of us in the population, right, or those surveyed, which is actually over age 50, If over half think that long-term care costs are covered, they're not making a plan for what that, if that's a possibility for them, or how they're going to have a strategy to help cover those costs. So it's important to understand what Medicare does cover and what it does not cover. In fact, according to Medicare Solutions, Medicare covers only 62% of expenses associated with healthcare services. That means you're going to have to pay the other 38%. Okay? That's a lot of out of pocket. According to the Medicare website, states that it is important to understand that Medicare does not cover everything, and it does not pay the total cost for most services or supplies that are covered. And one of the things that, it does not cover eye exams, for instance. Does not cover eyeglasses or contact lens for the most part. Medicare does not cover routine hearing exams or hearing aids. It does not cover routine dental care or most dental procedures such as cleanings, fillings, tooth extractions, or dentures. Medicare does not also pay for dental plates or other dental devices like implants. So there's a lot that Medicare does not cover that you're going to have to, if you're going to have need of those types of services, you need a plan. You need to make sure you're going to have enough income to help cover those kinds of expenses as well. So let's look at now a little closer look at what Medicare is. So when you look at original Medicare, for instance, that's Part A and B. Part A and B are your hospitalization and your outpatient. Secondary insurance, such as Medicare supplement plans, Medicare Medigap plans are also referred to, and then prescription costs, Part D. Or we're going to compare that to a Medicare Advantage plan, also referred to as Medicare Part C, and how it covers all of these things and how they differ. So, first one. Part 1. On option 1, Medicare Part A, this is your hospitalization. This is inpatient hospitalization, skilled nursing facilities, home health care, hospice. So to put that in concept, to put that in context, what you want to think in terms of is skilled nursing facilities as an example. It's not, even though that's also for long-term care, okay, medically you could have a stroke, you could end up in a hospital, you could through that how many ever days in a hospital, then need to go to a rehab place, which is basically your skilled nursing facility. Hopefully you recover from that. God forbid you should ever have a stroke in the first place, but these are understanding how the system works, and that's one example in terms of healthcare cost needs, whether there's a need for home health care as you rehabilitate from something like that. And then of course hospice and how that works. So first off then, when you're looking at the cost, for the first 60 days you have a $1,340 deductible. So that's if you're in the hospital, $1,340 deductible. Day 61 through 90, if you were in that long, you have a $335 per day copay. You're out of pocket. Days 91 through 150, that goes up to $670 per day. Okay, and then after 150, it's on you. So this is one of the, or all costs are covered, excuse me. When it comes to understanding how these plans work, on Medicare Part B is the next piece. That's your outpatient. So first off, hospital care, no deductible, no premiums rather. You do have deductibles and copays, and that's why you need additional insurance to help cover those, and that's where Medicare supplement plans can come in under original Medicare. Now, under Medicare Part B, our next one, that is your outpatient. This is doctors, providers, preventative benefits, durable medical equipment, outpatient services, and your monthly premium here right now is about $144. As they say, that's depends on your modified adjusted gross income. That's what that MAGI stands for. So depending on your modified adjusted gross income, if you have higher income, then your health care costs are going to be higher as well. You're out of pocket, in other words, when it comes to Medicare premiums, goes up based on how much income you have. And this changes a little each year. For that, if you'd like to get more information about it, or if you're not sure, just give us a call. But this is one of those areas when you get into looking at costs in retirement in particular when it comes to your healthcare costs, one of those areas is understanding, and this can happen, by the way, have someone that sells a piece of property and they have a large capital gain, or they sell off some stocks or stock mutual funds and they have a large capital gain. That large capital gain can impact your Medicare costs as well. Okay, so that can cause them to go up dramatically depending on how much income you have. So higher income individuals, as I mentioned, for most it's going to be at about $144 a month for your Part B, but for some, if you have higher incomes, that number could actually be double or more even. All right, so those are your, and when it comes back to Medicare Part B, your out-of-pocket costs, you're going to, you again, now you have a premium you pay, plus you still are going to have deductibles and co-pays on those costs. And here's something else to keep in mind. If you have, if you're 65, okay, and you're still working, and you have health care covered through your employer, you still would, most employers will want you to do this as well, by the way. You still want to sign up for Medicare, but maybe just Part A. Okay, which doesn't cost anything and will work with your private insurance with regard to hospitalization, those kind of costs. When it comes to Part B and your outpatient, on the other hand, you may want to hold off, and you can hold off without a penalty if you have health care coverage. Very important that you have health care coverage. Otherwise, if you delay, okay, and there's a penalty, and it's a lifetime penalty. So let's say I waited a year after I turned 65 and then signed up for Part B and I did not have health care coverage, they're going to charge me 10% more. That'd be about $14.40 more per month on the penalty added to my $144. So now I'm paying $158. And if I waited 2 years, another 10%. So it's 10% per year you delay if you don't have health care coverage and you're not taking Part B. So very important to understand how that works and to take advantage of it. On the next slide, well actually, okay, we're going to take a break. When we come back, I'm going to jump into this monthly premium bit a little bit more, adjusted for the way it is for today, and we'll get a little more down the road with regard to how this health care expense works, and also again the importance of how you invest. All right, making sure that you're getting the most out of your money, that your money's working as hard for you as you work for it to help you cover these increasing costs and expenses you're going to have in retirement. First a break. Join me here. We'll be right back on the Retirement Report.